Hi, and welcome to Unplanned, the show about cities and how they work. I'm Sam, your host, and before I go any further, let me remind you to hit the subscribe button for plenty more interesting conversations to come. But today's guest is a real thrill. He's somebody I've known for years. I consider him a friend. He's one of these people who basically changes the world every time he picks up a pencil and or sneezes. And so without further ado, I'd like to just welcome you, Tim Rowe, to Unplanned.
Thank you very much. Very glad to be here.
So Tim is the founder and CEO of the Cambridge Innovation Center, which is one of those places that has basically redefined how we work in the world today. That's my version of it. Tim will give you his own impressions about what it's done and what it is. And more recently, Tim has kicked off with, I'm sure with a bunch of other people, CIC Health, which is the newest iteration of CIC as it addresses the issue of COVID and COVID in the Boston metro area. And we're going to learn a lot about that. So without further ado, Tim, what have you been up to these days?
Okay, well, a few different things. Thank you, Sam, for having me on the show. So for your viewers' context, the organization I've been involved with for the past 20 years or so, Cambridge Innovation Center, has primarily focused on building what we call innovation centers. It's a relatively simple concept. Essentially, take a building, bring a lot of entrepreneurs and scientists together in the same building. They share a lot of resources. Those could include something as simple as conference rooms and kitchens to more complicated things like laboratories and shared equipment like life sciences equipment and so forth. We have been growing this concept around the world now for a couple decades. This year, actually, we opened our first locations in both Poland and Japan. And our vision is that we have an innovation center like this in each major city around the world that supports innovators. There are about 50 cities in the world that we see are kind of very innovation heavy cities, and our goal is to be in all of them. During the pandemic, as you might imagine,
Well, I just want to spend a second more on CIC before we get into the pandemic, because the pandemic is a whole topic unto itself, but CIC is also a whole topic unto itself. And I'm just curious, what impact do you feel CIC has had on the broader work environment? It raises so many questions, and it really, to my mind, just sort of reshaped how we think about what work is and how work can work, how people can work. What's been your impression from your experience?
Well, I would say that we're part of a movement we'll call the kind of the shared workspace movement. I'm proud of this particular ways in which we have made that work. But broadly speaking, the notion of working together around others with shared interests, I think, is a very powerful one. We're familiar with the notion of a university where researchers and scientists and students with shared interests come together and they live there for years, work there, get to know each other, share infrastructure, and that seems to work well. The notion of a university has been around for well over 1,000 years. The concept that you might do work in a similar environment is relatively new. Shared workspace is something that many people think that we pioneered, at least the first kind of larger version of that. There were actually a couple of great versions of it on the West Coast going back into the 90s before us. But the essential notion is if you bring these people with shared interests, but actually who are building companies as opposed to necessarily just researching into the same space, they will have the similar benefit that they might see in a university. Opportunity to share ideas, to learn from each other, to get help with challenges that they don't know how to solve, and really get their ideas out into the world faster. Our view is that innovation is the part of the process in society where we come up with new ideas and new ways to fix problems, and that's relatively hard to come up with new ideas that actually work to maybe get people from A to B better, teach them better, use less energy, all of the kinds of things that we try to do in the world. and bringing them together just works well.
Well, I'm going to jump in. I'm going to jump in here for just a second, because one of the specific issues, and it's not an issue, that's the wrong word to use, in relation to CIC and what you started in your background here locally in Cambridge, Massachusetts, is its proximity to MIT. And you once used a metaphor with me that I loved, and I remember it and sometimes share it, of a sort of an energy net or an energy catcher, so that MIT, this world famous and world changing university, is generating all this energy. CIC could be an energy catcher to hold it locally. Can you talk a little bit about that and what that means, what that meant?
So a great university can act as a kind of a fly trap for people with great ideas, right? If you have a lot of ideas, particularly if you're kind of science and engineering oriented, you're likely to get involved with the universities. It's a great source of talent, and maybe where you learned your skills. And so they kind of act as a magnet, drawing people from around the world into these central locations. A place like CIC, then plopped down next to university, becomes a place where all those ideas in the university can be converted into kind of actual products and services that benefit society. One of the distinctions we make is between invention, which often happens in a university context, although not exclusively, and innovation, which is taking an invention or a new idea and making it usable in the real world by society at scale. So the example we give is that, electric cars have been around for a long time, but it took Elon Musk and Tesla to kind of convert that into something that many people were actually buying. And until they were actually buying and using them, it wasn't an innovation, it was just an idea, right? And so these centers, these innovation centers, are places where you can kind of take that energy kind of drawn in a university and essentially convert it into useful things for all of us out here in society that want a car that is more environmentally responsible, or want a light bulb that uses less energy, or a better cure for a disease that your mom might have, right? And so
I'm going to, because we are going to get onto COVID, because of course that's the topic of the day. But before we do that, I want to spend, so Unplanned is a show about cities and how they work. And one of the aspects of CIC, which I think is the ripples are still to be felt and still to be understood, is, and I'm curious what your thoughts are on this topic, about what impact it's having or will have in the decades to come on the office real estate market. Of course, a lot of the buildings in cities are dedicated to workspaces, and you're changing that to some degree, or at least your model is changing that. What have you thought about that? Where do you think that's all going?
Sure. I mean, there are a few different things going on, right? First of all, historically, people have felt that they needed office space or workspace to work, right? So regardless of what you were doing, you need a place to do it. Most people did not want that to be in their homes. So it's awkward to have all of your employees come into your living room. If you're an entrepreneur, it may not be something that your spouse or significant other is okay with, or your kids are. So I think that there are some fundamental reasons why people have wanted physical space to get together outside their home. During the pandemic, I think we've really pushed the bounds of using our homes as workspace and connecting via video. We've all learned that it's much more possible than we thought. It works better than we thought. And at the same time, it's not the same as being in a place physically with colleagues. And it still presents those issues of having our work intrude upon our home life. So our view is that this notion of having workspace away from the home is actually going to continue. It's going to be a long-term thing. Yeah, maybe people will start spending a little more time working from home via video or something like that. But we think the mainstream will still have workplaces that are separate from home spaces.
Have you thought about its impact on the real estate market as a whole? I mean, there's a lot of money that's sunk into all these buildings. They cost a lot of money to build and to maintain and to keep up. Yeah, sure. What are you thinking about that?
So I think that as sharing of workspaces has progressed, you need fewer square feet per person. You need less dedicated space, and that does mean that perhaps you need fewer office buildings. What has generally happened as a result of that, however, is that as companies and individuals have chosen their workspace, they have gravitated towards more central locations because they've realized their goal is to be with other specific people, not just to have an empty space that they're working in away from home, but to be with people that can help them, that want to collaborate with. And that has sort of driven these workplaces toward concentration in easy to access sort of areas that everyone can get to. So what we're seeing is some of those buildings that are no longer being demanded as workspace are the ones that are kind of more far flung, that are perhaps not in central locations, and that those in central locations are actually still very much in demand. Their shape is changing, the way we're designing them is changing, but the need for them isn't changing that much.
Well, this could be a whole topic unto itself, but I feel like I owe you the opportunity to talk about your next greatest adventure, or venture, I should probably call it, which is CIC Health. COVID happened. It changed everything. In fact, Unplanned was born out of it, because I had this thought of, wow, we've run the experiment we never thought we could run. We've shut down an entire city for an entire day, and we could see how our systems worked and didn't work. What impact did COVID have on you? You have this reams and reams of office space that's shared. People are supposed to get close together, and now you have this airborne virus that is problematic, to say the least. Deadly is another word for it. What did you do?
I think everyone knows that most of us who could began to work from home principally. We found that in our laboratories and certain of our office spaces, actually lots of people are coming in. We've had a lot of companies based in our innovation spaces that are fighting COVID, and so their work required, continuing on in a more traditional way. But certainly a lot of people started working from home, and that meant that the workload for our team was lighter. They didn't have as many bananas they needed to put in the kitchen, as it were, and all the other things that go along with that. So we had team members who had some time on their hands, and we thought, well, what can we help with? We wanted to make it safe for people who were coming in to come in. And so one of our activities was to start putting together COVID testing capabilities in our various centers. This was new. Not a lot of people knew how that worked. It turned out it wasn't really that complex to set that up. You just needed to get in touch with the right laboratories that can do the processing and follow all the regulations, but you could start to test people inexpensively. And so we got involved in that. One thing led to another, and we started being asked to do testing, public testing, open public testing sites, so the general public could come in and get tests as well.
Well, talk briefly about that. What was the process? Because I can imagine, without knowing that. Well, I can speak for myself. People were very reluctant to go into any communal spaces, or certainly in the early days, the streets were basically empty. Nobody was willing to go outside the house. And then presumably some public entity approached you and said, hey, listen, you're doing testing already. Would you consider doing some testing for the public?
Exactly. And, remember that a lot of these public testing sites are parking lots. They're not necessarily going in somewhere. There are a bunch of different work styles of these centers. Even the ones where you are going in, it's possible to follow the CDC guidelines. Most people are comfortable going into a grocery store. These are well-managed spaces. It's not really that different, except you spend a lot less time in the testing site than you do in the grocery store, right? So, and by the way, mostly the people coming into these testing sites are not sick. These are people looking for confidence. They want to go visit a grandparent. These are the non-hospital locations. This is really for the general public looking for assurance that they're safe.
But talk briefly about that switch from you're testing your own folks in your own spaces to, hey, would you do this publicly? Because that's an interesting city story about you venturing into the public realm about this.
So in our case, actually, the first request for that came from the state of Vermont. Vermont was working with the same laboratory we were working with, the Broad Institute of MIT and Harvard. And the Broad Institute, which is an absolutely phenomenal laboratory, was not set up to set up public testing sites. And so when they got the request, they called us and they said, hey, we know you've got some skills at this. We know you're running sites for your own people and so forth. Would you be willing to talk to Vermont about this? And we had that conversation and indeed took on that responsibility. So I think we now have—
In the state of Vermont, you're doing this testing in the state of Vermont, or they're coming into Massachusetts? How is that working?
To my knowledge, it's in the state of Vermont. To my knowledge, I think we run all of the public testing sites across the state. Their goal was to have a testing site within a half-hour drive of anyone living in Vermont. And I don't know if they got actually 100% of that, but they got close to that goal. And so we have these testing facilities all over the state of Vermont. And that was just the first foray, if you will. After that, the state of Massachusetts did ask us to open a number of these sites, which we have. We opened a few ourselves that without anybody asking us to do it. And those ones are paid, since the state is not paying for the ones that we just went ahead and opened. So we opened one in Kendall Square, which is on a paid basis. It turned out that many people wanted to go to the free public sites, and that's terrific. But there were also occasions when maybe the hours were better or the lines were shorter or something, that people would be happy to come to the ones that we just set up on our own.
How complex was, how complex was this for you? This presumably is a whole new line of work. It wasn't where you started out with. You started out with shared work environments, and now you're in the healthcare business.
It's true. In the moment, it feels a little bit complex, but then you talk to a couple of experts and you get the rules and you learn it and you hire somebody who's an expert. And then before you know it, it's what you do.
Interesting. So go on. Massachusetts approached you. They were going to do some through you, and you also started some of your own. Sure. Is that the totality of CIC Health? You're now in a very big.
A lot of schools came to us. We're testing, I think at this point, maybe over 400 schools. Some universities came to us, some other states came to us. And so the testing work just kind of multiplied. It started with Vermont, but now we're all over New England, and we're in all kinds of organizations, also businesses, the hospitals. Most of the major hospital groups came to us looking for testing for their own staff. It turned out that we were set up to do mass testing for people like students and employees, and we could do that more efficiently and quickly and cheaply than, at least initially, the hospitals could for themselves, because they're set up for an individual patient coming in who will need a test, but not necessarily for thousands of people sort of simultaneously getting the same test. And that was what we were set up for. So we were fortunate to be invited by, I think, all of the big hospital groups in the area in one way or another to help. Nearly all of them. And
it's not like I hadn't quite processed that this is such a massive undertaking on your part. Talk a little bit about Gillette. So I know you're set up at Gillette, if I've got that correct. And what's that all about?
Well, so you have been asking about testing, which is really how we got started. About a month and a half ago, the vaccines were approved, and it became apparent that there was a need to run vaccination sites. And it occurred to us that we were not actually initially thinking that we'd do anything in vaccination, but then it occurred to us that what we were doing in testing was actually very similar to what was needed for vaccination. When you think about it, you're taking a large space, you're bringing thousands of people in, you're performing a medical service in volume. You have to have scheduling and follow-up and instructions in multiple languages and all of these sorts of things that we were doing in testing was actually very much the same for vaccination. And so we raised our hand and said, hey, if you guys need help, we're here. The state said, well, that's terrific, because we do need someone to help. And the first place that we were invited to do that was at Gillette Stadium.
And who's being served at Gillette? Who I assume it's the whole priority system of who gets the first set of vaccines, et cetera. What is the story there?
State-sponsored vaccination site, as most of them are, although not all. Within the state's strategy, they have several different venues where they do vaccination. There's a pharmacies program, so your local pharmacy may be able to do some, although the numbers are not at any individual pharmacy, they're not very large, but they can be very helpful. So for serving a local population, particularly those who are mobility challenged and so forth. And then there are some private places such as universities and hospitals that do a certain amount themselves. But the really big numbers are being delivered at what they call mass vaccination sites. And the first of those in the state was Gillette Stadium, which is, has the potential, we think, at scale to serve more than 10,000 people a day. And that will compare with maybe at best a couple of hundred in a pharmacy, something like that. So if you're really trying to get a large fraction of the population of an entire state to have access to vaccines, you're going to need to look at mass vaccination sites. And so we were fortunate enough to be invited to use our skills developed in testing to develop an infrastructure for vaccination.
And what is that? How hard was that to do? Because obviously there's safety concerns all the way through this. It's true for testing. It's true for giving vaccines. How hard was it for you to set up your protocols to make sure you were all set up?
It is quite complex. We actually brought in an individual we knew through our network who had run vaccines for one of the large pharmaceutical companies, who had had been through a pandemic before, been responsible for vaccination. That person brought a great deal of practical experience and is our vaccine coordinator. We do things such as constant temperature checks with independent systems, so that if a freezer, for instance, fails, we know soon enough that we can correct for that. We have backup storage. We have tracking down to the individual dose. We need to make sure that the doses don't go wandering, that they're only allocated to the people who meet the eligibility criteria. All of those sorts of things. It took us, it was a round the clock, working through every weekend, early morning, late at night effort. It took us 28 days from a standing start to have Gillette open.
That's simply it's just an incredible story. How would you, and I understand if this is not a question you want to go at, but how would you rate the overall system? Obviously, in any situation like this, there will be a lot of alternate opinions and critiques. How would you say Massachusetts has done overall from your perspective?
So, people believe that Massachusetts has moved slower than some other states. I think it's probably a little unfair because of the circumstances are different. And Massachusetts has a much larger urban population. Some of the states like West Virginia that have done well do not as much. I don't know how that impacts the penetration and rollout and so forth exactly. But what I can say is that I viewed a very professional implementation in Massachusetts. I have seen some really thoughtful choices Massachusetts has made, such as vaccinating homeless people very early in the process. Not every population is equally easy to get to and vaccinate. So if you start with harder subsets of the population to serve, you may move a little more slowly than another place that might start with, shall we say, easier segments of the population to serve. I don't think we know all of the impacts of those choices, but I don't think a direct comparison is entirely fair from state to state. What I can say is that the responses that we get at Gillette, and we're also now at Fenway Park, are unbelievable. I had an email this morning from a wheelchair-bound individual who said they had just an absolutely fantastic experience getting their vaccine at Fenway Park, and all of the special things that you need to do in order to make sure that the experience is positive for someone who is wheelchair-bound.
Who is staffing this? I mean, presumably you've been hiring a huge number of people to get this up and running.
We have indeed. These sites are staffed very heavily. We are fortunate in the case of Gillette and Fenway to be working with absolutely fantastic sports organizations. As you can imagine, they know how to get very large numbers of people in and out of their building in short periods.
Is that why those locations were chosen? Because of that fact?
Not only do they have those skills, but they also have buildings that are designed for it. All of the elements that you would expect that you might need for a mass vaccination site are present at an NFL football stadium.
Incredible. That's amazing. I will share with you in one of the policy groups that I participate in. They were talking about the vaccination and the state's effort at rollout, et cetera. And one of the comments in the conversation that was sort of going back and forth between people was there was a wish or a desire that the state would focus more on regional collaboration, say on the North Shore and the South Shore, and less on the pharmacies, partly because the numbers would just be greater if you could do a regional sort of North Shore collaborative up there, as opposed to trying to stand up these individual pharmacies. That was just a comment. You talk to people who are more integral to the whole process. I just share that.
First of all, I don't think they're just focusing on the pharmacies. There are a lot of different paths that they're taking. They're enabling all of the hospitals to do it, the neighborhood health centers and clinics to do it, the pharmacies to do it, and the mass vac sites. So I think it's a yes and is part of the answer to that. There are populations that have mobility issues and issues with familiarity with digital systems, for instance, to registration. The state took a little while to figure out what those issues were, but for instance, last week introduced telephone-based booking for people who have trouble with websites. They have a number of steps they're taking to help people with the transportation to the vaccination sites if they don't have a way to do that themselves. Remember, this is something that you need to do twice, or shortly it may be just once. So this is not something that you necessarily need to do many times. So if you do have access to transportation and you can use a website, which, let's face it, is most of the people in the state that will need a vaccine, then yes, it may be inconvenient for you to drive for an hour or two to a mass vac site. And if there is a pharmacy available locally, terrific. But it's not given that we've been in a pandemic situation for a year, an absolute national crisis, to ask people to drive for an hour to get the shot, I don't think, for those who are able to do that, I don't think it's too much to ask. We will have lots of answers, including good answers for those who can't do that.
Incredible. Now, what does this mean? We're going to wrap this up here. Obviously, we could talk for hours. Absolutely fascinating, Tim. And you just underline the fact that with Tim Rowe, you either go big or go home. What does this mean for you? It sounds like you are in a whole new line of work now. You have office space throughout the Boston region, and as you've just indicated, around the globe. Where does this all lead? I mean, you've got the existing issue of refilling your offices. Maybe they're already full, but you're also deep in the vaccine business now and testing business. Where are you going with all this?
I think right now we're really just heads down. We want to help people. We want vaccines to flow. We want as the highest possible fraction of this state to be vaccinated, is willing to be vaccinated and able to be vaccinated. That's our focus right now. So we're not spending a lot of time saying, gee, what do we do next? Certainly, when we're done with kind of making sure that the people who want a vaccine are able to get one, then all of us, I think that'll be a very large fraction of society, I think. And all of us will be happy to refocus on some of the things that we were doing before this pandemic. But sure, there may be some possibility for things that we can do that wouldn't have occurred to us now that we've gotten deeply into the health space.
Absolutely fascinating. I want to ask you one final wrap-up question, because Unplanned is about cities and how they work. Given everything we've talked about in the last 20-something minutes, what impact have you seen this having on the Boston metro area, on cities in general? You interact with a lot of different cities around the country, around the globe. What's your takeaway from the 30,000-foot level on what we've just been through, what we're going through right now in all its different aspects?
Well, it's a very many faceted pandemic, and it's difficult to say one thing about what the impact has been. We all know people who have lost someone, and the impact of that on families cannot be understated. In some cases, the people who were lost were someone who everyone relied on, either as a breadwinner or as an emotional anchor for a family or community group. There's incredible loss as a result of this pandemic. We have also seen what happens in many crises is that we are faced with new possibilities and new opportunities. My own family, I think we spent much more time together than we ever expected to. And that was a gift. I've seen more of my kids than I thought I was going to ever again, because my oldest is now off, or would have been off, in college. We see in the business world a kind of a reassessment. Things that people were doing that weren't really working are probably shut down. At the same time, that creates possibility to do new things, and there's a new energy. All those projects that were piling up on your desk, you may have gotten through them. Those house projects to fix something, hopefully you've gotten through them. And I think there's going to be a kind of a resetting that's occurred, and an enormous amount of energy, pent up energy, able to be unleashed. For people who make over $100,000, the impact has been very different from people who make relatively little. And so we need to remember that the impact has not been the same. People with lower incomes have had a much harder year. They were disproportionately unemployed as a result of closures of places like restaurants. People making over $100,000, does data show, are actually healthier, have better work-life balance, more family time, et cetera, and better exercise and so forth than before the pandemic. So it's this, the pandemic hasn't doled out its impacts equally, and that's something that we need to recognize and as a society deal with.
Tim Rowe, changing the world as always. Fascinating conversation. I guess I'd say congratulations on what you've been able to do, and thank you for your participation in making us I hope, we all hope, a healthier and safer society. Tim, great to have you on Unplanned. Real joy.
Thank you very much, Sam.